Today I'm going to teach about antidiuretics. I'll split this video into two parts. In first part, I will discuss about what are the receptors, where they are present, and how it is work. In second video, I'll discuss about use of the diuretics, adverse effect, and contraindication. So come on the type of the receptor where they are the antidiuretics acts. So we are having the vasopressin receptor. Then now discuss about type of the vasopressin receptors. So we are having two types of the receptor, P1 receptor and V2 receptors. Okay. Now discuss about V1 receptor. Okay. V1 receptor is again has a two subtype, V1A, V1B. Okay. So now we discuss location. V1A. This is present on the vascular smooth muscle, uterus, adipose tissue, brain, platelet, liver. Okay. And cortical CD, yani collecting duct cells. Then interstitial cell of renal membrane. Okay. Now discuss about B. V1B. Okay. So V1B is present in anterior pituitary cell, pancreas cells. Okay. Now discuss about V2 receptors. Okay. So firstly is present on principal cell of CD and collecting ducts. Then hell. Okay. Third, endothelium of the blood vessels. Okay. Now we will discuss about mechanism of the action, how the receptor act. Okay. So firstly we will discuss about how the V1 receptor is act. Okay. So it act via IP3 यानी कि inositol triphosphate and DHA pathway. By this, increasing the calcium level in intracellular. Okay. Now, what will be the response after activation of the receptor? Okay. Then response will be, first we will write vasoconstriction. Second, visual smooth muscle contraction. Okay. Then third will be glycogenolysis. Fourth will be platelet aggregation. fourth will be ACH release. Okay, so till this is active V1 A, this is active V1 B. Okay, now discuss about mechanism of V2 receptors. Okay, so this is active increasing the intracellular cyclic AMP concentration via okay. First response will be water reabsorption. Second will be sodium, potassium, chloride, co-transporter activation. Okay, then vasodilation. Okay, so water retention will be act on CD cells. Okay, this is act on thick ascending loop of the Hellman. Okay, now come on the action. Okay, how this is work on the kidney? What will be the response of the kidney? Okay, so action on kidney. Firstly, we'll discuss about V2 receptor that is present on the kidney. Okay, so V2 receptor action on kidney. Okay, firstly, AVP act on V2 receptor on principal cell of the collecting duct cells. Okay, where they are present? They are present on basolateral side. Where? Basolateral side. Okay, so after this, they leads to the activation of the receptor and increasing the intracellularly cyclic AMP. Okay, and increase cyclic AMP. Okay, after this, activation of the protein kinase A. Okay, this leads to the phosphorylation of the relevant protein. These protein will lead to promote exocytosis of aquaporin 2 that is containing in the water containing vesicles. Okay, promote exocytosis of aquaporin 2 where they are present water channel contain vesicle. Okay, okay. After that, these aquaporins get attached to apical membrane of the nephron cell. Okay, apical membrane of the cells. Action: reduce endocytosis of and degradation of water channel. So basically, this is increasing the water absorption. Okay, the water reabsorption capacity is directly proportional to the aquaporin receptors. Okay, channels. Then, in the high concentration, V2 receptor also increase the urea permeability in the terminal part of the collecting duct, and the receptor where they are absorbing the urea will be the urea transporter 1. So V2 also increase urea permeability in terminal part of collecting duct. Okay, and the receptor will be urea transporter 1. Okay, now action of the V2 receptor on the thick ascending loop of the Henle. Okay, so this is act by activation of the sodium potassium chloride cotransporter and increasing the permeability of these ion channels. So basically they are reabsorbing these electrolytes and increasing the osmolarity of the interstitium. Okay, then these lead to reabsorb electrolytes and increase osmolarity of interstitium. Okay, then action of the V1 receptor on the kidney. Okay, okay. Before that, I'll discuss this part in diagram. Okay, now we will discuss what are the mechanisms, how is the V2 receptor activity, what are the process to exocytosis of the water containing vesicles, and what are the mechanism of the reuptake degradation of the water channels. Okay, so this is the V2 receptor. Okay, here the vasopressin come and act. Okay, it's act on this. This is the G protein. Okay, this activate and releasing of the alpha subunit and get attached to the adenosine cyclase enzyme. After that, it's convert ATP to cyclic AMP. This cyclic AMP into activating the phosphokinase A enzyme. This phosphokinase A enzyme phosphorylation of the protein present on the cell. Okay, these proteins are responsible for exocytosis of water containing vesicles. These are the aquaporins, two channels. Okay, each vesicle contains four channels. After that, exocytosis of the vesicles and get attached to the apical membrane of the cells. Okay, these are get attached to the apical membrane of the cells. This is the luminal side. Okay, now here we need to reabsorb the water because this is the antidiuretic effect. Okay, and this phosphokinase also activating the urea transporter 1, which is secrete the urea in the lumen side. Okay, so this is the diagrammatically presentation of the exocytosis of the vesicle, reabsorption of the water, degradation and urea transporter. Okay, now come on the action of the V1 receptor in the kidney. Okay, so we'll write here. Okay, so V1 receptor present in vascular smooth muscle. Okay, of vasa recta. Okay, so what is the action? Okay, it's lead to the activation of the V1 receptor of the vasa recta. It causes the vasoconstriction and then reducing the blood flow in the vasa recta. This lead to the reduce the secretion phase of the kidney. Okay, so we will write activation of the V1 receptor of vasa recta, the causing the vasoconstriction. This led to the reduced blood flow to vasa recta. Okay, and when the blood flow is reducing in the vasa recta, the secretion phase of the kidney is also reducing. Reduce secretion phase of kidney. That's how the urine output will be reduced. Okay. Now, other action. B1 receptor also present in the medulla of the nephron, kidney. So, action of V1 receptor in medulla of kidney. Okay. So, activation of B1 receptors. Okay. This increasing the synthesis of the prostaglandins. Synthesis of prostaglandins. This increased prostaglandin will oppose the action of the V2 receptor on the collecting duct cell. Okay. So, like now we'll understand this is opposing the V2 receptor and the activation of the V1 receptor, how they are helping in the concentrating the urine or manage the mechanism. Okay. So now this is the physiological action. Okay. Whenever the basically V2 receptor is more susceptible to activation in response to the vasopressin, and V1 receptor activate only when the vasopressin present in high concentration in the blood. Okay, whenever the vasopressin is present in high concentration in the blood, it will be against the body mechanism. Now it will increasing the water uptake, retention of the water, electrolytes and all. So we need to oppose this action, activation of the V1 receptor. So now we will write V1 receptor activated only in whenever the high concentration of the vasopressin present in the blood. Okay, and V2 receptor activate when vasopressin present in low amount of concentration also. Okay, so now we need to oppose the action of the V2 receptor in the high concentration of the vasopressin. Okay, so it will be help in the homeostasis of the body. Okay, Now other action of the receptor, vasopressin receptor. So action on the blood vessels. Okay. First, V1 receptor जो है, it causing a vasoconstriction. Okay. So by this action, it is helpful in cardiogenic shock patient. Okay. Because in cardiogenic shock patient is already reduced to blood supply to affected organ and body. So we need to maintain his BP. Okay, so we need to activate the V1 receptor which causing the vasoconstriction, and vasopressin help in shock patient. Okay, now second action, V2 receptor. V2 receptor causing the vasodilation. Okay, by what? By releasing of the nitrous oxide via the endothelium of the blood vessels. Endothelium. Okay, this is action of the V1 receptor. And now additionally we will discuss receptor present on the other body organ part on cells. Okay, in GIT, it's increasing the peristalsis movement in the gut. So it helps in the expulsion of the gas and emptying the bowel. So it is helpful in radiography, radiography of the bowel. Okay, so we want to expel out the gas and other content of the bowel, so it will be easy for the diagnosis. Okay, action on GIT. Okay, so visceral smooth muscles. Okay, what they are doing here, increasing peristalsis of gut. So, okay, so it will be helpful in expulsion of the gas. Okay, and emptying of bowel. Okay, now action on uterus. Okay, it causing a contraction in the uterine muscle, because this is also the visceral smooth muscle, no? Contraction of uterus. Okay, now action of platelet. It causing the aggregation of the platelet by the releasing of coagulating factor 8 and VWF factor. Okay, von Willebrand factor. 8 and they are helpful in the activation of the platelet, aggregation of the platelet. Okay, now in the liver. Okay, in the liver, it causing the glycogenolysis. Okay, so here we cover all the receptors, what are the subtypes, where they are present, what are the general action, and now we study separately on the kidney. On the kidney, where the receptors are present, how they are works. After that, discuss on the blood vessels, then GIT, uterus, platelet, and liver. Okay, now we will discuss about uses, adverse effect, and contraindications.